This is a program for nurses, by nurses.
The right side pulsating.
Whether you are currently a nurse or a student becoming a nurse, it is our hope that this program will help you,
Deep breath.
provoke you, offer you tools, encouragement, and hope.
Great.
I'm very proud to have the word RN. Registered nurse means that I'm a caring person, I have skills, I'm competent, and I can also help other people. And that's when we talk about a healthy America, it cannot happen without RNs.
You are about to see and hear 4 nurses.
She's sleeping?
They have won the Inspired Comfort Award,
That is superb.
presented by Cherokee Uniforms to honor America's nurses.
Nobody more deserving.
Prizes are awarded after judges choose from hundreds of applicants who are nominated by their peers for exceptional service, sacrifice, and innovation. This is Bob Wilkinson, a pediatric oncology nurse.
Start of a new week for you?
Start of the new week, yeah. See what we have on the floor. We're just coming in for chemo and get it all started again. All done, my dear.
Bob's patients are very sick children, children with cancer and other disorders.
It's a great profession for men. A lot of the families talk about how much they enjoy having men as their nurses, whether it's adults or children. Men can learn so much, and young men learn even more, I think, because even before they become fathers or they work in pediatrics, I think they learn to appreciate parenthood and to see the interactions of other parents and good parents going through a hard time.
This is Ardis Bush. She has been a nurse at this hospital for over 25 years. She started as a staff nurse and became a nurse manager.
Nobody made me become a nurse. It's my choice. And because it's my choice, I expect to do my very best to take care of the patients that I serve.
Hi, Angela, by the way. How are you? And this is Jay. Hi, Jay.
This is Angela By the Way.
Favorite place. They still.
She is a nurse care coordinator. She helps families that have children with special needs to gain access to vital resources in their communities.
It's one thing to tell a child that they need physical therapy and that would help them, but it's a whole different issue to help them be able to get physical therapy and to be able to talk to insurance companies and to write letters of medical necessity for those things, to be able to help those families to be able to advocate for themselves.
Hey, Colonel, sir, how are you? Huh?
Colonel, hell, I ain't the colonel, you are.
You're the colonel. No, pardon me, you're the general. How are you doing, sir? How much more weight have you lost, sir?
And this is Mona
And
Counts.
I mean, it's forever that she keeps that strep throat.
Mona is a nurse practitioner at this primary care facility.
What's that for? This is your allergy medicines.
Her center provides health care to over 5,000 patients who live in the heart of Appalachia.
And if Tina and I can figure out which Tuesday, then we'll come down and bring enough flu shots for everybody you can drag in.
Worry about it.
What makes nurses special? What might these nurses have to offer you in your career as a nurse? What these nurses have to share can motivate you to keep on going, even when the going gets tough.
I fight for quality of life every day. You okay? I fight for comfort, no pain, no nausea. Can you say supercalifragilistic?
Supercalifragilistic.
Awesome. I fight that my fellow nurses and myself treat each one with dignity as we would be wanting to be treated if we walked in these halls with a sick child or a sick parent. I fight for myself to to give me a future with a purpose, a fight that I with myself to make sure that what I do is right.
Even if it means
You are about to see these nurses at work. Their employers have allowed us to film them, their patients, and their co-workers in order that you can see their approaches to nursing. They are approaches that we would like you to consider.
we gonna set you up. Okay. All right.
Well, hello,
Doing my nails.
Dana. Well, hello.
You must get to know your patients.
It's so nice to have you.
You must dig in and go behind the medicine. Get to know them as unique individuals, outside and in.
Hey, I'm growing old here.
What happened?
I just started not being able to breathe. They brought me in here. My daughter's dead.
Okay. Who are you living with? Your daughter?
My daughter.
Circle where you think the pain is.
What is going on in a patient's life? What are they thinking, feeling?
But when you have pain, when is it? What is it?
When you ran really hard, things like that.
Probably a 3.
A 3? Okay, good.
Okay, we're back to the beginning. Where were you born?
Little town called Booth.
At home or in the hospital?
Home.
Home, okay. And how far did you get to go in school?
6th grade.
And then what'd you do?
Transferred me to Wayne Board, but I quit.
Okay, are all your sisters and brothers alive?
Yep, they're all dead.
They're all dead?
I'm the only one left.
What all illnesses have you had?
Well, I've had heart attack. I've had 6 strokes. And I have a complete hysterectomy. And I have a couple, 3 ulcers, not ulcers, but what do you call them? Hernias in my stomach, which they ain't been taken out yet. But there's gear to them kind of my lungs.
Okay.
Well, that's about it.
When did this episode start?
Oh, just about 3 days ago.
About 3 days ago? Anything you did different that set it off?
Not that I know of.
All right. May I listen to you a little bit?
Yeah.
Okay.
How are patients being affected by the drugs that they are being given? Are they anxious? Could that hurt their recovery?
The doctor came by to see you today?
Yeah.
And what's his plan for you for today?
Are they feeling depressed? And do they need special assistance?
Is there anything that I can do for you? No.
You got to know
You remember my name?
how the nurses feel, how the patients feel, and how the families feel. And without that personal understanding, he's going to be depressed where he's at. I think you get lost in the machines and the beeps and the blips. So yeah. Can I sit down on your bed? I'm getting old. I'm getting tired. So what are you going to do when you go home? Eat what? Steak and shake? So what are you going to get, onion rings? When they get onion rings. What do you usually get? Steak and shake. Bless her heart, she doesn't smile anymore. You talk to her mama. So every time we go in there and we mess with her, she cries. So it's hard to make her feel good. I mean, Mom does with touching her. But you know, as a nurse, you want to make them feel better. You don't want them to cry when you're doing something with them. And on the whole, you can do something with most kids, but she's just so miserable.
We are part of the Medical Home Project, which is...
As a nurse, you must learn to speak up. You are the one who most often is called upon to talk with patients.
How are things going today? Good.
This gives you the chance to understand each patient's issues and concerns and it allows you to present medical information in terms that can be understood by everyone involved.
I want to keep her on antibiotics because
She's been on antibiotics. She's had a shot of antibiotics. She's had.
Communication is about dialogue, conversation, interchange.
Have you used a nasal spray?
Yes.
As communicators, nurses must be first-rate listeners.
Nothing is clearing her up. Remember, I'd asked you about the mass toys because she had come up with them.
What matters to patients and their families? What level of pain or discomfort is acceptable?
My grandfather used to work a steam shovel. You ever seen those steam shovels that dig big scoops of dirt and stuff?
Whether you are new to nursing or not, use your life experiences to help you communicate simply and calmly.
I went in a helicopter instead of an airplane.
Did you go in a helicopter?
I got to sit in Poppy's lap.
Yeah.
And I got to sometimes drive.
Okay, you can run over there now.
Cars.
As part of the dialogue, you must always be ready to raise the tough questions and discuss them.
Is it Alzheimer's? I don't think it is. I think the more you get involved and stay involved, you're going to have less fear that you're getting Alzheimer's. If you focus and you listen, the patient will tell you what's wrong with them. They won't tell you in the words you think you ought to hear it in. They won't tell you in the words that you see in the differential diagnosis books. They won't tell you in the words that you can read in the pathophysiology books. But if you listen very carefully, they will tell you what's wrong and what they need.
Hi, Ms. Stevens. How are you?
I'm feeling fine.
I'm Bush, the nurse manager on the unit.
Patients who are informed can take more active roles in their own care. As the primary source of information, you must tell patients what they need to hear in ways that empower them.
I like to have a little cup of coffee.
Oh, okay. And you know that one of the reasons why you probably need to restrict your caffeine, try converting to decaffeinated coffee. You ever thought about that?
No, I hadn't thought about it.
No. Have anybody ever talked to you about your diet?
No.
Oh, okay. Well, we have a dietitian that'll come by, and I'll ask her, can she come see you today, okay?
All right.
All right. Because you need to talk about the decreasing your salt and the fat in your diet and your caffeine.
All right.
And
Doctors want me, Everett Hospital want me on blood pressure pills.
at the rate you're going, yeah. Have you been running high?
Yeah, it's been 138 over 116 and 110. And
You know the goal, don't you?
yeah,
What's the goal? 120 over 80 or less.
You have a right to have your pain managed while you're here, and that's what we intend to do.
As a nurse, your job is to make the complexity blend into the background so that your patients can make sense of what you're saying.
Let me know.
My whole goal is, what is the person's idea of where they want to be? Can I educate them well enough in a way that they can understand so that they make good choices regarding their quality and how to maintain it or achieve it? You got some real liquid wax? Stop putting
yeah,
Q-tips in it.
Oh, okay.
No, not, didn't your grandmother tell you that? Nothing in your ear smaller than your elbow. Go ahead.
You can have a patient in a fully automated hospital room with diagnostic equipment that diagnose the problem. You could have robotic arms passing the meds, but you can't simulate the contact, the connection between two people, especially when one's a healer, like a nurse.
It's pretty good.
It's pretty good?
Yeah.
Yeah. It's feeling better? He liked playing with soldiers. He really likes to do that. We got some secret stash back there from Christmas.
There are so many profound issues and details for patients and their families to deal with. You are the person that can help them to cope with it all.
You got an airplane? Yes, I do. Is that going to be good, you think?
Yeah, these 3 soldiers.
I got some more in my hand. You and your bro will be able to play pretty good.
That one's falling.
Few people have the chance to help lead others through life-changing events,
Now you just got to make sure you got good shoes on, and you need to
to
look where you're
encourage
going.
them,
Yeah. You know what happens is you curl over like this, and instead
To
of
comfort
seeing
them.
everything where you're walking,
I know.
you only see that little spot. So if you
I know.
to provide a
put
way.
the backpack on you, pull your shoulders up. You know, like they used to teach you in high school. Come on, get those shoulders back. Get them up. Come on. There you go. You know, if you walk that way, you see a lot better.
Yeah.
Back. Get them up. Come on.
If they're alone, or if they're a mother or a father or a wife, they're looking for you to have some kind of comfort, some kind of word and empathy, because they're going through a great deal of stress. They're going through the unknown. I mean, nothing's more clear than that, than to be on the floor when they will in a new diagnosis, a child, and see that look on a mom. On a parent's face. I mean, especially if you're a parent. I mean, it's just like a kick in the gut. But then you have to realize what are they going through and then how to deal with it, so then they can begin to do the progress. So they can begin to listen to what's going on with the child. They can begin to prepare themselves to listen to the physician, to move on from there, because it doesn't stop.
Taking care of every detail is what makes a nurse truly multidimensional.
Keflex.
You must know and feel comfortable with science, technology, pharmacology,
First my 20 milligrams, yep. This is
equipment,
Mr. Johnson to go down.
hundreds of details.
Touch your head. You're standing up straight.
When people are ill or think they're ill, they become psychologically weak. They're fear, and so I'm able to allay anxiety. I'm able to help people reach higher goals, and sometimes just by learning about themselves and how to cope with illnesses is more than telling them what the medicine is, because usually they know what the medicine is, but they don't have a good grip on their lifestyle changes or even outcomes that may happen.
Ask her, can she come see you today?
This is a good example of hyperactive bowel sounds.
There are always younger nurses coming on board. They are the profession's future and its lifeblood. You must help to educate them.
Let it open to the air.
You must mentor them and support their efforts to become great nurses.
Hey, I'm Joan.
Get out of here, you. Don't touch me.
So are you having a...
No, I don't want nothing. Get the heck out of here. I want nothing.
Well,
nothing.
I'm Joan, and I'm going to be your nurse today. If you need something, would you let me know? Do you have your call button? It's right here.
Why? I push it, nobody comes.
Well, you know, I will come if you push it.
All right.
Okay.
Good job.
Okay.
I was a tough one. We have that, though. That is not that unusual. There's a famous saying by Vincent van Gogh, and it goes kind of something like this. If you treat a person the way that they act, they will be less than what they can be. But if you treat a person as if they are better, they'll become the best they can be.
The nurses who appear in this program were asked what they would like to share with you, what they hope you will take away. Here's what they said.
When I finally became a nurse, when I first had my license in my hand, I wore white. Oh, I was so excited. I was just so excited because it took forever. But, and then it moved too fast. They start pushing you to become charge nurses and assistant nurse manager. All I wanted to do was, okay, I'm finished. I'm going to be a nurse.
When I started on nursing, I got hired because I was the extra strength and oomph on a rehab floor, and which was fortunate because I got a job. But male nurses are such an addition to the floor, and a lot of the guys, I think, may not say it openly, but I think they're happy to have males on the floor.
Anyone that assumes they know it all makes me very nervous. I'll tell patients when they're, you know, who knows what's wrong, and I'll say, I have no idea what's wrong.
I think the qualities of an experienced RN would be one that is willing to learn and willing to give of herself. She doesn't always have to be right, and she doesn't have to know all the answers, but she does have to know where to look for them, and she does have to be willing to humble herself enough to look for them and say, I don't know the answer to that, but you know, let me find out and I'll get back to you. He has oxygen at bedtime? Mm-hmm. Does he have a BiPAP?
As a nurse professional, you must train yourself to question, be a student for life, prepared to learn every day.
How can that be a transfer? Where'd they go? Where'd they go? Northern California.
Keep up with advances in nursing. Continue your education. Stay current on best practices. If you don't know the answer, ask. Feel comfortable enough in your own skin to say you don't know and that you need help. There will always be someone to help you.
We don't dilute the stuff, do we? Take it straight as.
I dilute it in saline, just because I don't know how much.
Now let me go yank Lucy's chain again. Since they started doing this instead of giving us our Zofran. I need you, my dear.
Okay, what you got?
This is Zofran that I drew up for
Yeah.
Alvarez.
Okay.
You need to dilute it any?
No.
Just
You
take
can
it
give
straight as.
Uh-huh.
And we're pushing the decks,
Yeah.
right?
Right.
All right.
You can actually just give it over 3 to 5 minutes.
You're a part of a team that's taking care of that patient, and that physician only is part of that person's time on that floor for a very limited time. You as a nurse are the one with the patient all the time, and if you're observing him and talking to him and doing the vital signs, then you got a better idea of what's going on so you can communicate it to that physician.
Sometimes doing what's right, maybe questioning an order or asking a physician, you know, telling him that the patient said this. And, you know, even though sometimes they may think that a patient is malingering about something, you know, the patient has rights. We need to take care of it.
I can't do my job as effectively if I don't have a good relationship with Ms. Bush or the nurses under her command. So I look upon it as being a, for lack of a better phrase, a really value-added experience for the patient. When the doctor and the nurse are in sync, the patient benefits the most.
It's almost over.
Almost over. We'll do this so I don't leave the next shift with something that really falls on my ball court. The stresses are everything when you hit the floor. You're going to have the stress of the shift leaving and giving you a report. Your own personal stresses are going to be that you're going to be in an environment, if you're new, that you don't know. And so it's a matter of just learning. It's like going to college and first days going to classes. You have to learn your environment. Some things I do to relieve stress is A, be willing to wail at God, because that's going to relieve your stress. B, be willing to laugh and to make others laugh. C, don't be full of yourself. So, and in turn, you can let go of that stress and not hold on to it. D, find your place or places that you can go that's going to help you wick it off, going to help you forget it. Well, sometimes you get so involved with taking care of everybody else, you don't take care of yourself as well. You talk to all the doctors that take care of nurses, they'll tell you we're probably the most non-compliant group of people in the world. You've got to establish some kind of spirituality. I think, especially if you deal with death and dying, you have to be able to believe in something. I guess most people would think the most heart-wrenching thing that I've done or do may be dealing with the death of a child, but I don't know if that's really it. The most heart-wrenching thing is not to have the answer for a mom or dad who asks why their child has cancer or sickle cell anemia, why their child's in pain. Okay, I'm sorry that stung. I'll talk to Lucy about it. When they look at you and are hurting because you're having to start an IV, this is still okay. Because you're doing something that hurts them. Push in slow, it's gonna be high up, so you're not gonna feel it, okay? That's what hurts the most, when I can't make that child not have pain, when I can't stop the nausea and vomiting, and when I can't be able to convey to that baby that my touch is hurtful to them, but it's trying to give it comfort. That hurts. Every day ends and tomorrow begins. And one day, 1 year is not your whole life. And you can always change to a different floor. You can always change to a different place if you need to, especially with this nursing shortage. So once you see that the stressor is, I don't like emergency room, then go to somebody, because they need nurses. They're going to be willing to talk to you in a good establishment and find you a place within that hospital on a med-surg floor, or give you a better mentor. And so you want to talk to people. That's a key thing. Good night. Thank you. You're welcome. I'm Bob Wilkinson. I'm one of the nurses on 7 West.
Bob takes care of his patients as if they were his own children. I mean, he just always went the extra mile to make sure things were good. We weren't in the hospital, we were in just a home away from home. And Bob made it that way.
In cities and towns across America, there are times when the community gets together to honor nurses for their commitment, their skills, and their compassion. This is a chance for patients and ex-patients, for friends and families, for all of those who understand the importance of nurses to a community, to say thank you.
Your compassion, personal sacrifice, and courage are examples for all of us. We believe that the community of Mount Morris is incredibly fortunate to have you and your staff of professionals taking care of us.
I'm floored. I don't know what to say, and all I can say is thanks to all of you.